Back on America's Forum, Rick Blackwell in for JD Hayworth this morning. Hope you're having a great start to your Monday. Medical ID theft in the United States is on the rise. A new study shows that the crime is affecting more people than ever. 2.3 million people have been affected by the crime, with the total cost to victims weighing in at $20 billion. The average payment for most victims, over $13,000. Former Congressman Michael Flanagan stays with us right here on America's Forum, and we're joined also by Nick Tate, Newsmax Deputy Health Editor and author of the Baby Boomer Survival Guide. Nick, I didn't know that much about medical theft. Tell us a little bit about why it's such a huge concern and what we can do as patients and consumers out there to make sure it doesn't happen to us.
Well, Rick, you know, most of us have heard about financial identity theft, where someone steals your credit cards or your bank information or your social security card number, but medical identity theft is a new kind of crime that is actually rising. According to a recent estimate, the numbers of people who've been affected by medical identity theft have gone up by about 22% in just the last year. Now, what happens is thieves steal your medical information, your clinical records. They may steal your insurance card, and it allows them to file claims with Medicare, Medicaid, or your insurer, and order drugs and or scam those organizations, those insurance companies, and the government for money on your dime, and you are liable for it. One of the reasons that we're seeing more cases every year is that the move toward healthcare reform is driving many medical records from paper records to online electronic digital records, and of course those digital information can be lost in breaches that affect tens of millions of Americans.
The technology is great, but once you get it electronically, obviously, there are cause for concerns. Twila Brase joins us right now, president and co-founder of Citizens Council for Health Freedom. You know, Twila, if someone takes advantage of your credit card, you can call the credit card company immediately, the bank, you can get that card canceled. It seems like you're going to have to jump through a lot more hoops if your identity is threatened or compromised when you're dealing with right now medical costs.
Right. Well, your medical records are specific to you. It's not like you can't get rid of your medical records. You don't even want to get rid of your medical records. So what it requires is for you to look into your medical records wherever they are and see perhaps what has been put in there that's not about you. Perhaps there are allergies that aren't your allergies, or medications that are not your medications, diagnoses that you have never had. And for most people, this is a very expensive endeavor and a very difficult endeavor to make sure that the information that is about you is actually about you and not about somebody else. Especially now as the country, because of laws that have been passed at the federal level, is moving towards a national medical record system. Imagine you're seeing your doctor and your doctor says, well, I see that you have had this condition and you're allergic to this. And you say, no, that's not true. And he says, well, it's very clearly in here that it is true, so I'm not going to give you that medication. And it takes a while for you to probably figure out that this is somebody else's information, somebody who has used your record in order to get access to your insurance or to get access to Medicare, to Medicaid through you. And now it's up to you to try and clean up the mess and reclaim who you are as a patient.
Nick, I'm sorry, maybe you can tell me, in a society now that requires everyone to have medical insurance, whether they want it or not, you will have it under the law, and apparently the administration agrees if I like my identity, I can keep my identity. Maybe you can tell me what the real motivation is for stealing someone else's identity to get medical treatment if I can have my own health insurance and I'm required to have it.
Well, medical records have as much as 20 times the value of financial records on the black market, because they can allow thieves to put in for fraudulent claims that allow them to get more money than they might otherwise be able to steal from a bank account. You know, Medicare, Medicaid are relatively unlimited funds that can be scammed. And, you know, as we pointed out, the toll is about $20 billion a year, but that's expected to grow. Now, I actually have a question for Twila. With Obamacare, with healthcare reform, with insurance companies and doctors and healthcare networks going more and more online, do you see this problem growing? And really the question for consumers I would ask is, what can you do about it if you discover that you are a victim of medical identity theft?
I do see it growing. It's one of the problems with the push towards a national medical record system. because now we have created or will create a bigger and bigger target as our medical records get connected without our consent, mind you. They'll get connected, and therefore it becomes a place where there are more and more entrances or entrance ramps into this kind of information. And for hackers and for others who wish to have access to it, it just becomes easier. As you probably know, Anthem, Blue Cross Anthem, 80 million people's records were accessed. And then in Premera Blue Cross, 11 million people's records were accessed. When you have these kind of systems that connect all of this information together, it just becomes a very valuable target to those who see how much money that they can make off of our medical IDs.
You know, Twila, we didn't even get into the fact that they can also change, what medications you take, your blood type, diseases, so much information out there. If it's compromised, this is a major problem. But I want to shift gears a little bit. Recent article in the New York Times talked about the fact that an ER doc was worried about overweight pregnant women, pregnant, obese, and in danger. There are so many health ramifications related to women who are delivering babies and they are obese. Nick, talk about that. What are some of the health concerns that obese women pose to not only themselves but also to their babies?
Well, what this piece really pointed out is that hospitals are just not equipped to handle these kinds of extremely obese pregnant women that come in. That there are dangers not only to the children, but there are also dangers to the women. Gestational diabetes, elevated blood pressure, birth complications, a greater likelihood for cesarean sections, which increase the risk for surgery. So what this really is it's another sign of the times that as a nation we are becoming very, very overweight and very, very obese, and we need to get the word out. Doctors are trying to raise the word out for pregnant women that you should be not limiting how much weight you gain, but if you are obese to begin with when you're pregnant, you need to take that into account.
Twila, as we march away from a very personal relationship between a person and his doctor, but to involving the government, an insurance company, and apparently national records, what other problems do you see coming on the horizon other than the ubiquitous fraud and theft?
And Twila, just real quick, you got 20 seconds to answer this one.
Okay, so I think the loss of the patient-doctor relationship is going to decrease the trust that people have when they walk into the doctor's office. They're going to realize that everything they say, somebody else besides the doctor may have access to, and so it's going to change what they're willing to say, and therefore whether or not they're able to get the care that they need.
All right, Twila, you did great. Thanks so much. Just a reminder, you can learn how to survive the baby boomer financial crisis with this book. And now it's time for a Newsmax Now update on this Monday morning.